Keep in mind that we start pancreas in a transverse plane, because typically when we scan an organ, we get the long view and then we do the axial view, and the pancreas lies transverse oblique, right? So we're going to start transverse. First few images are long axis. So my probe should be at a transverse oblique view. My tail is superior towards that left shoulder, and the head is inferior. If I just put my probe at a transverse plane, notice how I only see the body of the pancreas. I lose the head, I lose the tail. If I go oblique, now I've got the tail, body, and head there. Okay, so the first two, I know I have two long axes here, but they might look similar, or depending on how challenging the patient is, you might get a little more tail in one, a little more head in the other, but the general idea is to show as much pancreas as possible in both of them. So I'm going to use this left lobe of the liver, and I'm going to angle behind it, inferior. So this might be one picture, and then I'm going to try take a deep breath. I'm going to try a little bit of a different approach, see if I can get it a little better. There's two. Okay, so I've got, yeah, this is obscured a little bit laterally on both sides, but I can see the general shape and size and echogenicity of the liver here. Okay, so that would be long axis. Now for the remainder of your transverse views, we're basically taking each part and we're just hyper focusing on that part, but still staying in a transverse plane. So now I'm going to do the head and the uncinate, and I'm going to take this and I'm going to try to put this more centrally located so I can take a measurement. So I might have to move my probe slightly more to the right side of the body in order to do that. Might adjust my depth a little bit. Push out on your belly. Let's see if that helps improve. So I'm using this uncinate process, this border here, to see if it helps. Breathe normal. Let's see what my best view is. You guys see what is this anechoic structure in the head posterior? CBD. So CBD is posterior lateral, and then see the GDA, anterior lateral. Can you guys see that? It looks like a little snake, kind of like with eyes. Do you guys see, like, this is the head of the snake and these are the eyes? I don't know, I just made that up, but it kind of does look like that. Okay, so I'm going to try to get as much of the lateral border, the anterior border, and then this uncinate by using the portosplenic confluence to help me kind of identify all of its borders. This is the stomach here, the pylorus, so it's kind of obscuring it. Let's take a deep breath. Let's try one more approach there. Breathe. So this is the border of the body, and then I can use my imagination. It kind of comes here. This is liver, and this is the anterior border, and this is the duodenum. But I can see here she's got a pretty large uncinate. So I'm going to do my caliper from anterior to posterior here to include the uncinate. So that would be her head and uncinate measurement there. I don't want to measure here. This would be the neck. And I don't want to measure here. This would be the body. So you want to be lateral to that portosplenic confluence. Include the anterior border and the posterior part, which often kind of abuts right up next to that IVC. Okay, so that would be head and uncinate. Now I'm going to go to the body, and again use my border here, the anterior border. Sometimes you'll find that the splenic vein is optimally open at its largest point. Sometimes you'll see the splenic vein, but you kind of sweep superior, inferior, and you get the body thicker without it being open. So you just really have to evaluate that person's pancreas. So over here would be neck. The body is going to be where the splenic vein runs, and it's usually the more narrow part. This would be the anterior part, and this would be the posterior part. Notice how her SMA, her aorta, those are posterior to the body area as well. Now I'm going to move to the tail, and I'm going to make that the center of my focus. So notice I'm staying transverse, but I'm just hyper focusing on each part individually. Head and uncinate have a measurement, the body has a measurement, the tail does not. So now I'm kind of angling my probe more towards the left side, and I'm going to increase my depth. You don't want to be too shallow where you're cutting off the posterior border here. You want to have enough perspective that I can actually see the border of the tail, like how deep that it goes. So that would be good for tail. Okay, body and tail. Did you have a question?
Can you also decrease the sector size?
If you're doing transverse, because it's the long axis, I would not decrease the sector size because it's your long view. Okay. Same thing with sagittal. There's so many, not for the pancreas, I wouldn't, because there's so many landmarks that surround it that you need, that it kind of causes you to lose the perspective of helping you navigate what's what and where things are. So I wouldn't decrease the sector for any of these. Okay, so that is transverse. Now we're going to move to sagittal. This is where you guys sometimes struggle initially, but once I say the light bulb kind of goes off, you go, aha, it's like an aha moment, and it starts to make sense. So if I'm looking at a long axis, this is a transverse view, okay? When I go in a sagittal plane, I'm going to get a sagittal view of this part of the body. Then that would be the head. Now I would rock to the left side, and this would be the neck. Then I'm going to do the body, and this would be the sagittal view of the body. And then the tail, it'd be like a big blob of tissue. So it kind of looks like blobs of tissue when you go and evaluate the sagittal view. You really have to use your landmarks and the building blocks, kind of like your Legos, what's above, what's below, what does it look like, to help you know which part you're in. And also, if I think of the sides of the body, this is the right side of the body, this is the left side of the body. So when I'm scanning on my patient, if I start in the middle here, okay, where the body is, the SMA, if I want to get to the neck and head, I've got to rock to the right side. If I go back to the landmark that I know where the SMA and the body is, and I want to get to the tail, then I have to go to the left side. So it's actually just a rocking motion from the right side of the body to the left side of the body. You do varying angles just to elongate it, but it's generally right to left. That's all we're doing. Many people like to find a landmark that makes sense to their brain. I find you guys often like to use the body and the SMA because the SMA is very familiar to your brain. So if you start there and then survey from right to left and kind of hyper focus and follow the tissue, I find that that's very helpful. So if I'm on the SMA right here, where this is what right here, where my copper is. What organ is this? Liver. And then this is stomach. Okay. This is my body right here, just this tiny little piece. And notice how I'm getting a little piece of the splenic vein. So probably 95% of the time when you see the celiac and the SMA, kind of the celiac goes superior, SMA goes inferior. If you look directly anterior and in between those two, your body of the pancreas is going to be there. Okay. So now I know what the tissue looks like, and I'm going to hyper focus my attention on this as I rock to the right. You guys see I'm still on this tissue here. What's this structure here? This is actually the SMV. So remember where we're going, the splenic vein is at the body. So when you're transverse, you're just getting a piece of tissue here and one little slice of, remember, whatever you see a structure in one view, if you see it long, when you go to the other view, you're going to see its axial view. So in transverse, I see the long view of the splenic vein. When I go sagittal, am I still going to see the long view? You're just going to see a little axial view of it, okay? So here is body. This is it. What should the neck look like? Anybody remember the sign? Hamburger sign, right? So do you guys see a hamburger here? This is my burger. This is the S&B. This is the neck. And then below is the bottom bun. That's the uncinate. Okay. I'm going to keep rocking to the right. And now I see more IVC. And this is my portal vein. And then this is my head. Okay. So this is all the way to the, and this is her bile duct, which is, you don't always see it like that. So this is tissue here. This is head, neck, body, and then when I go to the left, the tail is going to come down inferior and kind of come at an angle superior, because remember it goes up superior. So you're going to see it kind of come down posterior and to this side. You won't ever see it go like this because this is inferior. Okay, so I'm going to go back to my body. And I'm going to rock towards the tail, and now this tissue, I can kind of see it coming down. I'm going to increase my depth. All of this is tail, this kind of chunk of tissue. So this is a transverse view. When I go sagittal, this is all tail. So for the head of the pancreas, your landmarks you're going to look for, just like when we're in a transverse view, the IVC is going to be posterior. Okay, that's a landmark. So you see the IVC. And then remember, this is a confluence. So your portal vein is going to be your landmark. So it kind of looks like your portal veins here, and then a blob of tissue is like this, inferior to it. You won't, if you're in the head, you're not going to see the vessel going through the tissue. If you see the vessel going through the tissue, your hamburger sign, you're in the neck. And I need to rock more to the right side. So here's my portal superior. I see my IVC posterior. This is my head, this blob of tissue right here. You guys see that? So head, neck, here's my neck and uncinate, and there's my S&B. I relieved a little pressure. Sometimes if you apply too much pressure on the vein, it compresses and then you lose your burger, and you guys are wondering where the burger's at. So I relieved a little bit pressure just to help me identify the landmark. There's neck. Then here's my little body here, a little bit of the splenic vein. Here's my SMA, celiac. You don't have to document the SMA and celiac as it doesn't have to be there. It's just a guide for you to really help. There's body, and then tail. Often I have to decrease because it's deeper. And there's my tail. So tail, body, neck, head, neck,
the whole screen.
body,
The whole freaking
tail.
screen.
What is it?
That's the tail.
So this is the tail, all of this. You see the border? This is the border of the liver here. And here is the tail. Notice how this is all the same echogenicity. Yes?
What's the hyperechoic line though? Is that like a ligament?
Here?
Yeah, to know the separation between the liver and the tail.
Here?
Yeah.
Or this? This is just the interface of tissues between the liver and the pancreas. You've got some interstitial tissue there. Same thing when you're in a transverse plane. Notice how you can see the border here between the liver. This is liver tissue, this is pancreas tissue. Where it becomes a little challenging is if you have a patient whose pancreas and liver are very isoechoic and they kind of blend together. So you really have to find a structure or a landmark to kind of follow its borders and imagine the shape of where it should be and how it should course in the body. When the pancreas is hyperechoic, sometimes that actually makes it easier because it really pops out at you, and you can see the difference in the liver and the pancreas tissue. So I'm going to do that again. Here is head, neck, body, tail. Tail, I like to go all the way out. I'm sweeping all the way to the left where I just see nothing but stomach here, and then I kind of come back towards it, and then it helps me know how deep the tail is and how large. So you're sweeping all the way out to the right, then there's head, neck, body, and then I'm gonna go all the way out to the left and then come back. Yes.
How do you know how the depth you said is?
So is the objective in your field of view? So like for the tail, it's deeper, so I'm gonna need more depth. If you don't, adjust your depth, you might show me tail. Yes, I see it here, but there's a lot of tail I'm cutting off. The same idea when you're in a transverse plane. Yeah, I have pancreas here, but look, I'm cutting off all of this tail. So I really need to increase the depth to show the border of the tail. If I'm doing the head, okay, so I like to keep my landmark, my IVC in. So I'm not going to adjust it so much that I'm cutting it off. You lose perspective. You guys kind of see the difference of how to know. I feel like you're asking, like, how do I know if my depth is enough or too much? I like to keep the landmark in with it. And then when I'm going through those landmarks, I don't want to lose that because it's hard. Like if you just showed me this, it would be very hard to identify what it is. Okay. But with that surrounding landmark, I don't want to go too deep because remember what's below the spine is useless. Okay. So, all about a little bit of perspective. And do you have the objective, the whole objective?
So where's the head? Like, I don't get.
So remember, in a transverse plane, we see the whole organ because it's long view, okay? When I go sagittal, I'm sagittal on the body, I'm just getting head, I'm just getting neck, I'm just getting body, I'm just getting tail. You're only...
Instead of looking at it like this, you're looking at it like this.
Exactly.
Yeah, but I just couldn't figure out
Yeah,
where to
just
see
like
it.
that.
Yeah,
So,
for side.
I like to start with a landmark that I know. So here's the body. So now I'm going to rock to her right side. So now I'm on the neck because I can see her. Here's the neck tissue here. See this border? Here's the burger. Here's the uncinate. Then I'm going to rock further. Notice how my portal becomes superior. In the head, you will not see a vessel go through the tissue. That's why I said it's like portal and a chunk of tissue inferior to it. Okay, if I see a vessel go through the tissue, then I'm on the neck. Okay, so that's the best way, I guess, that I can. You have to be able to identify the tissue and then follow it as you're sweeping through the organ. Okay, if you don't identify where the tissue is, then you're kind of lost in no man's land and you're thinking like the livers, or you're thinking the shadow is it. So once you can identify, for sure, then I say hyper focus because you're just keeping your eye focused as you're rocking your probe and see how the structure, the shape changes. Okay, so there's no measurements in a sagittal plane. That's the demonstration. Thank you, model.